Hi, my name is Bill Richards. I'm a physical therapy assistant here at OSC's physical therapy department, and today what I'm going to discuss is an ankle program. So basically whether your situation is weakness or a lack of range of motion, such as after surgery or an injury, what we're going to discuss is basically maybe 3 or 4 components of a good program that you'd be involved in if you're here at OSC's physical therapy department. All right, well, with Zach Dean's help, he's one of the physical therapy techs that we have here. One of the components I first kind of mentioned was strengthening. So one of the things we can use is this rubber band called TheraBand, and depending on what color you use, depends on how much resistance that band is going to have. So Zach's going to demonstrate what we call plantar flexion, which is basically pumping the foot, which is part of the calf muscle group we're working on. So usually you have that problem with an injury due to lack of strength. The other one we're going to show is eversion. So you can bring the other foot up. And again, or basically hitting all the motions of the planes that the ankle kind of moves in, because each plane or each motion uses a different set of muscle groups for that. So that's what we call eversion. So another direction where the ankle goes in is called inversion. And it's just a matter of, very simply you can see we're going against the resistance here. Program may be 10, 20 reps, depending on what your therapist decides at the initial evaluation. So the last one, which I'm going to do, is what we call dorsiflexion. This is where the patient's pulling their foot towards them. So again, this is if obviously you realize when we walk, basically our toe has to clear the floor or the ground in order to swing and not trip over our feet. So it's real important. This is usually one of the main muscles, the anterior tibialis, which is a muscle along here, which a lot of times is involved with an ankle injury. Okay, one of the tools that we have here in physical therapy is what we call a BAPS board. And it's a very simple kind of a round board with a knob we put on the end or on the bottom side, depending on what size, how much motion we want to try to increase in the patient's ankle. So this happens to be for the right side. And 3 motions or 4 motions we kind of work on is just clockwise and counterclockwise. Just like when he was doing rubber band, he brought his ankle out and brought his ankle in. This is kind of do the same thing. So you just kind of do like a counterclockwise circle the best you can. Which you can see, all these muscles in here in his leg are trying to get that board to roll around. So a big component of that is we're trying to eliminate any exterior or extraneous motions, upper leg, which patients tend to do when they have that weakness in that area. So we can get them to isolate the motion down the ankle, to do all those motions the ankle should do, and that's going to improve on that. So one of the other exercises that we can do for strengthening is basically using body weight to do this. Basically it's called just a calf raise. So he's basically come up on his toes. You may have him pause a second or two and do that 20 times. Because obviously this is also part of the ankle function that should have is be able to raise ourselves up. And you want to do a toe raise. Just the opposite, come back on your heels. So another thing, again, it's like dorsiflexion. What he's doing right now, which kind of complements like the rubber band when I was holding it, he's doing the exact same motion. So that toe has to have the strength to clear the floor when you walk. So if you have an ankle injury or surgery, sometimes we're lacking that. So this is another tool that we have to improve on that.